We will be responding to your letter. We're currently working on a response to the letter that I know you guys are also delivering today. So we appreciate you coming by. I'm happy to take it. We're taking the letter very seriously, and we've met with Department of Health regarding the letter. So, we will have a response possibly as early as the end of the day today, but we are still working through a formal response. So we certainly appreciate you guys coming. Just a little bit with the scheduling here, I apologize. The governor's not even here yet. He's not back yet, I don't believe. So, but they are here.
An hour ago, he was down at the cafeteria.
Yeah, but he's coming back for the Juneteenth event, which is a private signing with the legislators and the advocates for Juneteenth. So I'm happy to take the letter now, but we will be getting back to you all through whoever sent the letter originally. We will be getting back to you.
And we did try to meet with you after our visit here in January, and you never responded to us. And so I think the people of Pennsylvania have an even more urgent need to talk to the governor now. So we hope that you'll meet with the Better Path Coalition.
I don't set the governor's schedule. I am here to accept the letter and let you know that we are working on a response with the Department of Health to the letter, and I think answering the request that you had in it. I don't have the ability to get a meeting right now, but we certainly will take the letter and respond to it in time.
So
this is sort of what we heard last time.
I understand. I can give you the
things are worse now.
I understand, sir. I'm just here to accept the letter. I am happy to, in our response, give you the contact information for scheduling, but I don't do that. I'm just here to take the letter, so I appreciate that.
Well, it'd be nice to get return emails when you send in requests for meetings. And so, because we're representing those communities that are affected by these cancers, and all the other communities in Pennsylvania, for which no health report has ever been done, no reporters survey has ever determined how many.
So I just want to let you all know as well, and we'll be passing this along in our response, but the Department of Health has conducted a literature review that was just published this week in a medical journal about environmental impacts in public health. That is a literature review that was done by the Department of Epidemiology here, along with the department in Colorado. It is a joint it was reviewed and published just this week. We will be sending that along as well in our response for you to take a look at, but that did look at from my understanding, a review of all literature that was available regarding environmental impacts from oil and gas development. So the public health impacts from oil and gas development. So I will be happy to get you that as well. That was literally just published. It's been a long effort that they've been undertaking with the state of Colorado.
Well, the more important thing, because there are endless literature reviews like the Compendium, the standards, all this, but
I understand that, and I appreciate that, but
to actually go to the communities rather than just meet with us here. Go to the communities and see firsthand. That's never happened.
So we have one of the authors of the Compendium here with us right now, so I think that we should maybe hear about that. You know what the Compendium is?
I understand what the committee is from, just some updates today, but I'm
just listen.
Yes.
So this is a copy of the compendium that we want to provide the governor.
Okay.
That is Concerned Health Professionals of New York, of which I'm a member, and Physicians for Social Responsibility have reviewed the literature on the risks and harms of fracking. We have grave concerns about the deaths of the 13 children in southwestern Pennsylvania and the rising rates of cancer among children and young adults. When kids and young adults get cancer, we can't blame it on smoking, drinking, or holding stressful jobs. We don't have any hereditary links to these kind of cancers, and they arose in this community at the time and in the place when the fracking boom moved in. So this body of data is something that we want to put in front of the governor.
Okay,
so this is
thank you.
For him.
And I will take it, and I will also make sure that we get this to the Department of Health as well as the governor.
Okay, it looks like the folks from the Juneteenth event are coming into the office now, so I want to give you the letter.
Okay.
I have two questions. The first is, what is the time frame that we can expect a response? You don't have a date, but a time frame.
I actually think we will have an initial response today from both the governor and Dr. Levine, and then we'll also be sending you a formal letter in response as well.
Okay.
Will you be handing this letter to Governor Wolf yourself?
I will be right now, yes.
Great, that's great.
Yes.
Will you tell him that the pediatrician from Pittsburgh is telling him there's only one response. There's no more than one response, and it's to be a public health champion. And that's really what we expect our governor to be, is a champion of public health and only public health, not of industry, not of special interests, of public health.
Okay, I appreciate it. Thank you very much for coming. My name is JJ Abbott.
Oh, JJ, hi, I'm Craig Stevens. Hey, JJ, remind the governor, he was in Dimock, Pennsylvania, where the waters looked like that for 10 years, on August 6, 2014, when he ran. He promised when he had power, which he didn't have when he was a candidate, he'd be back. He's never responded or come. We'd be honored to have him come up and see. Maybe bring the lieutenant governor, who's very interested in this also. That is him in the living room of Victoria Schweitzer. The other building right there is Scott Ely, who that's his waters been like for 11 years. So we'd love to have him come up, see it in person, read that, and then I think his position will change on things because we're hoping so. Ours definitely has.
Okay, thank you very
I would
much.
also add that
Thank
on
you.
the day of his inauguration,
you.
he told 8-year-old Madison that he would visit the victims, which is something he has not done.
Okay, sir. Thank you. I appreciate it. And I just want to, with our response, I just want to note, will not obviously be a response to the compendium, but we will review. So just in response to the letter, and then and I'll also send along the literature review that was just completed by the Department of Health. Okay.